We have a keynote speaker who has come in from out of state. Will kind of I think, help shape the conversation for the rest of kind of what we're going to do today. And he is he's an advocate, he's a speaker, he's an author, a media commentator, Ryan Hampton. He travels coast to coast and adds solutions to our national addiction and drug overdose crisis, and we need solutions. There are multiple pathways to recovery, lots of different ways to get there. And if it gets you there, then it works for you. And we want to encourage that. And Ryan is in recovery from a decade-long opioid addiction, and he's regarded as a forefront expert and thought leader in America's rising addiction and recovery advocacy and drug policy reform movements. He's an alumnus of the Clinton White House. He's worked for presidential administration and worked with multiple nonprofits. And as you know, frequently it's the nonprofits are where the rubber meets the road on this stuff, right? And you are valued. And so now he's a prominent leading face on Voice of Recovery Advocacy. And really trying to change those long-standing negative narratives of those who are impacted by addiction, recovery, and overdose. So through his books and media, organizational campaigns, social content, it reaches millions. He breaks down cultural barriers that have kept people suffering in silence, and is helping to inspire a new generation of advocates, which is really important for common sense policy. He lives in Nevada with his husband, Sean, and their boxer puppy, Quincy. That's good. I have a Chihuahua, by the way. Chihuahua. Please join me in a warm welcome for my friend, Ryan Hampton. Thanks so much for being here.
Morning, everybody. This up here. I'm a little tech challenged also this morning, so bear with me. Okay, great. It's great to be here. It's great to be in King County. Grateful for your welcome. You know, I have the privilege and pleasure of being able to speak all around the country, and I can tell you there's no place where I feel more at home. There's no place where I feel more inspired than when I'm able to be in a room full of folks who are on the front lines of the addiction and overdose crisis, particularly with people in recovery and folks with lived experience. I just want to say that, you know, each of you in your work and for showing up today, all of you are necessary and are the lifeline of the recovery movement, not just here in your state, but around the country. So before I kind of get into the heavy stuff, I want to say thank you. Thank you for what you're doing. Thank you for your commitments. Thank you for your time. Thank you for your talent. Because if we're going to have any shot at curbing these alarming overdose numbers that we continue to hear about on the news, it's going to be because of you. It's going to be because of your work. So it's important for me whenever I get to come to fancy things like this to identify myself. So I am Ryan Hampton. I'm an author. I'm an advocate. I am a dog lover. Quincy is at home right now. I woke up this morning in the hotel and I was like, "Where's the dog?" And I'm like, "Well, the dog's not here because you're in King County, Washington." I'm a husband. I just got married 2 months ago, actually, to the man of my dreams, something that I just never thought was in the cards for me during 10 years of active use and being unhoused. I'm the founder of a few nonprofits, one called the Voices Project, another one called the Recovery Advocacy Project, and a national initiative called Mobilize Recovery, which I am going to talk about in a few. But most importantly to me, I am a person, identify as a person in long-term recovery, which means to me, I haven't felt it necessary to have a drink or a drug or any mood or mind-altering substance since February 2nd, 2015. And thank you. You know, and I think it's probably no shock to the folks who are in this room, but the landscape for how addiction treatment, recovery support services is delivered, not just here in Washington, but across the country at scale, has completely changed in the last couple of years, mostly due to COVID. So, let there be no doubt, the pandemic did have a devastating, debilitating, catastrophic impact on our community. This is one of the reasons that I believe now more than ever, the voices of the recovery community, the voices of the recovery movement are so critical. So let me see if I can do this. Okay, great. So let me just set the table for the next 55 minutes or so that we have together by sharing some stats. The current landscape of our modern day addiction, recovery, and overdose crisis. 1 in 3 households, right? 1 in 3 households in the United States of America are directly impacted by substance use disorder. An estimated 23.5 million Americans qualify as having a severe substance use disorder to alcohol and or other drugs and need some sort of medical treatment or supportive services. But knowing that number, only 1 in 10 people who need medical support, which is approximately 2.6 million, receive the treatment that they need. The result is a treatment gap of more than 20 million Americans. This treatment gap has remained stagnant for the last 15 years. It's something that all of us should be concerned about. During the pandemic, over 1,000 addiction treatment providers closed their doors, many of them permanently. But, there is hope. There are over 23 million people, just like myself and your council member and so many who are in this room, who live in long-term recovery. Now, these numbers tell us a lot of things, but it makes one thing absolutely clear to me, and that's that the voices of people in recovery are necessary in these conversations, and I'll get to that shortly in a moment. So the 2022 to 2023 preliminary data from the CDC. Now, mind you, I just updated this slide deck last week in preparation for this presentation. And when I updated it, it was 107,689 Americans that were projected to die or had died of a drug-related overdose last year. Since I wrote that number on that deck and got here this morning, that number is now predicted at north of 108,000. It's constantly changing. More than 932,000 people have died since 1999 of a drug overdose. Now, I think you all are on some cutting edge stuff and innovations here in King County and certainly throughout your state. But as I travel, around the United States and I have the opportunity, to be in front of a governor or city council members or state legislators, I always ask, what's the magic number, right? Like, it feels like there has to be a magic number here where we start to get the resources and the attention at scale that this issue truly deserves. Because I can tell you, if it was 107,689 Americans from any other public health disease, we would be upside down as a country trying to figure out how to get to the bottom of it and what we can do to stop it. And look, as someone who, I think today is remarkable because today is the end of the public health COVID emergency. It happened today. And, as someone who has lost loved ones to COVID, has a mother who is at very high risk, what I'm about to say is not to take away one bit from our response to COVID. It's just to make a comparison that we do have the infrastructure, we do have the ability, we do have the willpower when we, give the appropriate attention and focus to these public health issues. We spent trillions of dollars in marshaling a public health response in states and counties and federally around COVID. we did things that weren't done before. I had door knocks from FEMA, right, coming to my door, wanting to make sure that I knew where I could get resources, what was available to me to mitigate the spread of the disease. I was able to go to, pretty much any pharmacy within an earshot to get a vaccine. We had a vaccine that was developed in record time. It was done with such extraordinary bipartisan unity. And it is notable to say that when that happened, there were two public health crises, declared public health crises in the United States, one being COVID, the other being overdose in this country. We can see how you respond to a public health crisis through the lens of COVID. And I think there's a lot of lessons to be learned in how we have been responding on the overdose crisis. So now I talk about recovery. I talk about, recovery advocacy a little different than some of my community. So I want to take a moment and I want to share, where my values come from, right? Why I believe in the power of our recovery community to combat this national healthcare crisis. At my heart, I am a community organizer. What you see here is a chart of community organizing, but really organizing in the recovery movement. It's about a simple principle, right? And it's about leadership, and it's about building more leaders. And there's many definitions of leadership, but there's one that I subscribe to. I actually have it printed out, posted above my computer in my office at home. I read it every morning. And this definition, if you're a note taker, is accepting responsibility for enabling others to achieve a shared purpose under conditions of uncertainty. And that definition really strikes a chord with me. And I think for anybody who does this work, because we live under such uncertain conditions every single day when it comes to the drug overdose crisis. Organizing in the recovery community, it's about a shared story, right? We have a shared common story. That story leads to commitment, which leads to building structure and infrastructure as a community, developing a strategy for action to build power within our community, and hopefully achieving some positive net results along the way. It's about asking yourself, three fundamental questions. The first being, who are my people? Who are our people? The second being, what is the change that our community, that our people need? And how can we turn our resources into the power we need to achieve the results that our community needs? So given our time constraints today, I'm going to focus on one particular part of this grid, which is the shared story, which is also otherwise known as a public narrative. It's the story of self. It's my story. It's the story of us, right? The story of my community and the story of now, where I come from, where my agency comes from, where my passion for this issue comes from, how this shared story and values can help to craft forward-thinking public policy, forward-thinking advocacy and work for those in our community, for those in my community who are seeking help. And I learned early on in my recovery, very early on in my recovery, that this community, the recovery community, we're actually really good at storytelling. We're really good at sharing our stories. But sometimes, more often than not, because of the storytelling technique that we use in our own personal recovery program, we're not that great at sharing them as an effective public narrative in the public square that would move, hopefully, people's feet to action towards a common goal. We're typically used to sharing them in a context that involves what it was like, right? What happened, what it's like now. Public narrative is a very different type of storytelling. It's a very different type of craft that's new to the recovery movement. So before I begin sharing a version of my public narrative that I use with larger groups outside of my personal recovery community, let me just give you the official definition of what public narrative is. Again, for any note takers, as used in the context of community organizing. So public narrative is a leadership practice. It's a leadership practice of translating our values into action. It's based on the core fact that values are experienced emotionally. As such, these values are sources of ends worthy of action and the capacity for action. So when I get to speak to outside audiences, I usually will start with my own public narrative. And when I get to share it, it does remind me of my why I have made advocacy for the recovery community my life's work. And I'd like to share it for the next 12, 14 minutes or so with all of you. So I'll never forget that morning I was sitting in this green lounge chair on the deck where we used to have our Saturday morning check-in meetings. It was this cold and early Saturday morning about 7 years ago in Pasadena, California. The mood for that morning check-in was complete confusion. We sat in this round circle like we always did for our weekend check-in meetings, but this one felt particularly different. There was something that was wrong. You could see it in everybody's face. It was silent. You could hear a pin drop. You know, at this point in my life, I was still holding on for dear life. I had walked into that recovery house less than a year earlier with nothing but the clothes on my back. I was on public assistance. I had no job. I had no transportation. I had no health care. I suffered from severe depression, multiple attempts at taking my life in the previous years. I was confused. I was alone. I think more than anything, though, I was afraid. And I knew how hard it was early on to just hold on. And some days I really wanted to just throw in the towel and give up. Go back to where I was most comfortable. Where I felt most comfortable was in isolation. It was on the streets. It was wandering in this never-ending spiral of chaotic use and his drug use. And as dark as that sounds, that's a place where I didn't feel judged. That's a place where I actually felt welcomed. That's the place where I didn't worry about being told that I was different, that I was othered, somewhere where I didn't belong. And on those dark days, I would pick up the phone and I'd call my mom, oftentimes. My mom, who was nearing 70 years old at the time, she always had some sort of wise and calming word for me. Her tone was particularly slow and it was soft. She reminded me that when I was 15 years old and my father was in federal prison and our family had essentially lost everything, that I would stay up late at night with my little sister and I'd help her do her homework while my mom was out working her third job, just so that she could keep some food on our table. I can remember, nights when things were particularly tight in my family. My mom would go to McDonald's. They used to have this thing called 29-cent hamburger day and 39-cent cheeseburger day. And my mom would go to McDonald's and she would get enough hamburgers and cheeseburgers and she'd put them in the freezer so that my sister and I would have something to eat for the rest of the week, because she'd be out teaching night school till 9, 10 p.m. at night. And my mom would remind me these days when I'd call her that as long as we stuck together, right, that everything would be okay. My mom never gave up. But even though we had each other, my mom, my little sister, and I, loneliness was this defining theme in my family, in our small family unit when I was growing up. Because for the better part of my teenage years, it seemingly felt that we were unwelcome in community settings that I essentially grew up in. Our family's story in this small town of my father's incarceration was very big news. People we used to spend holidays with, right? People who I'd have birthdays with when I was younger, they would look the other way when we would walk into the community center and to Sunday church services. And it felt like we were no longer welcome because we were different, right? It felt like we were on our own. And when we would be shunned or we would be forced out, whether it was from the church that I had received my first communion at, or the house that I grew up in when we got evicted and thrown out, when we felt like we were on the brink of utter and total collapse as a family unit, my mom, she'd be our backbone. She'd be our strength. And she'd tell us that everything's going to be okay, because together as a small family unit, we could actually go out and we could build somewhere, a new place where we did belong. And she'd remind me that when all seems lost in the world, there's always this thing called hope. And that if we stuck together, that maybe, and hope together, that maybe it could carry us to a better place as this small family. So I completely, to my core, understood how my friend Nick felt, my roommate Nick felt, when he came home to the sober living that night before, and he told me that he had had a recurrence of use and he was using heroin again, and that he felt like he had lost all hope. I knew how he felt when he told me that he couldn't stop using, that he couldn't stop on his own. Now, Nick wasn't just any roommate, he was my roommate. He'd been my roommate for about 8 months previous in very small, close quarters in this recovery house, sober living. He was 24 years old at the time. He had the whole world ahead of him. He was an aspiring musician. But Nick didn't think he had the whole world ahead of him. He was afraid. He was begging for some sort of way out. He was begging for some help. But Nick couldn't tell his job. Nick couldn't call home and talk to his family because they had kind of given up on him, didn't want to hear from him. He had no insurance. He had no money. He had no sort of absolution that's in sight. And to top it all off, because of the rules of this specific recovery house, he was going to be unwelcomed at that recovery house at the stroke of midnight. Now, it's not debating the policies or procedures of this house. I understand the rules of the rules, but it was something that was completely out of my control. And simply put, this was one of the first moments in my early recovery where I felt completely powerless. And I can remember that night sitting on that deck where we were having our meeting and looking at the clock and having this feeling of anxiousness, seeing it was 11:43 and Nick needed to find somewhere to go within the next 15 minutes. And I thought to myself, wait a second, isn't there a hospital like within walking distance of this sober living, maybe half a mile? Don't they have some sort of, medical detox or some sort of mental health unit? Couldn't we just send Nick there, let him go for a day or two, get him medically cleared, which is the term that our sober living was using. And then after he spends a day or two at that hospital, he could come back to us at the sober living. We as peers could do what we do, help him get back on his feet, support him, and just get on with our recovery and trudge this thing together. And we all thought that was a great idea because we had no other options. And so that was it. That night, Nick packed up the few things he had. He walked to the hospital, to the ER room, and that was the last time I saw him. He went to that hospital and he waited. I'm not just talking about any hospital either. Like this hospital, and I won't name it, but is known for one of the largest medical system endowments in the United States. Over $1 billion in a medical endowment that they have. Gorgeous, huge hospital. Wings for every single health disorder you could think of. When my friend Nick went there to their ER room, he sat there in their waiting room and he waited. It was like he was treated as like some kind of second, third, or fourth class citizen. He wasn't even seen by a doctor when we finally were able to get our eyes on his medical records. He wasn't even triaged in to see a doctor. He showed up, he told the triage nurse what was going on. They had no place to go, that he was chaotically using heroin, that he was afraid that he might overdose if he wasn't going to get some help, that he had no place to get to that night. And you know what the nurse of this very well-known, renowned hospital did? She gave him a piece of paper, white piece of paper with a bunch of crisis hotlines on it, told her they were too busy that night to deal with it, and that he should call some of these hotlines the next morning if he was willing to get help. This hospital told my friend Nick they couldn't help him. I think that many of us in this room all know that feeling, right? We all know that feeling of what it feels like to be turned away, to be told that we're unwelcome, to be told that we need to try the next house on the block. It is probably one of the most defeating feelings that any human can feel. So the next morning, sitting in that green lounge chair, we all knew what was coming. The owner of this house didn't have us circled up, 4 hours before our regularly scheduled house meeting to break good news to us. So he got us in the circle, and then he spoke. He said something like this. He said, "Listen, guys," this was an all-male house. He said, "Listen, guys, this is what happens." He said, "Sometimes people die. Last night, Nick overdosed a few blocks from here. He died. I've been telling you this from, the day you all got here. You got to buy a suit when you get into early recovery because you're probably going to go to a lot of funerals. And this is just the hard facts of life. Sometimes people have to die so that others can recover." And I repeat that statement even from this stage, and like the ball of rage inside of me just wants to scream at that statement. And I know that that's a statement that's still used in certain recovery settings, and no disrespect to that. But I can tell you my own personal experience that I am certain that my friend Nick did not need to die so that I could be here today. And it took me months to really realize what happened that day, to really understand what was going on. Nick is top of mind pretty much everywhere I go, every opportunity I have to speak about why I do this work. And I didn't know it then, but his death and then the subsequent deaths of many other friends that just started to happen one after the other sent me on this journey to ask why. Why is this happening to my community? Why is this happening to the people that I love? And in the summer of 2016, that question led me to a union hall right down the street from the sober living where I was still living. I showed up there with about 100 friends of mine, friends of Nick's, friends of others that we had lost to overdoses that year, to stick that question to my community. Why? Now, in the summer of 2016, it was election season, much like we're about to go into in a couple of months. And caucuses and primaries were being held across the state. They were making selections for delegates to the national party committees to nominate their respective presidential candidates. And by this point in my early recovery, we had buried so many people that I was desperate for any type of a solution, but equally as desperate for people just in our own community to hear us, to listen to us, to meet our community, to hear Nick's name and Tyler's name and Lisa's name. And I mean, I could go on and on. And, it made me remember those days when my mom, she'd be up working late. She'd have me and my little sister go walk to our grandmother's house. And, my grandmother, to help pass the time, she would walk my little sister and I to some sort of city council meeting or a local conference like this, or a county commission meeting. And she'd get her pencil out and she'd pull out the agenda, and she would just sit there and she would teach us how laws were made, how, civic participation worked. And that same year, when I found myself in 6th grade, once again, removed from the community I used to be a part of in yet another school, I thought maybe, hey, a great way to find some belonging, maybe I'll run for class office. So I had put up poster boards and, made calls to classmates that I found in the yearbook. And this was back in the days when they used to list the address on the yearbook. So I would walk to people's houses and I'd knock on their doors and introduce myself. And I took the opportunity of making 6th grade policy change seriously. And that year, when my grandmother taught me about civic participation, I actually won that election. So in a sense, when I showed up to this union hall with my friends from my sober living, I was hardwired for this type of solution. It was now the second time with my name on the ballot, but although it felt a very far departure for sixth grade, I knew that for us to be heard as a recovery community, we had to get out of our comfort zone and step up and become a part of. We had decided that the organizing strategy for us a few weeks prior would be to register me as a candidate for this delegate convention with no intention to win. The only reason we did it is because it guaranteed me 30 seconds to speak in a room just like this, full of judges and members of Congress and city council people and county commissioners, so that I could tell them not my story, but I could tell them Nick's story. I could tell them about what was happening 4 blocks away from where that union hall was and ask them to step up and be a part of this solution and to do something about it. We had no intention to win, but the result is something that has guided my advocacy over the last 7 years. We showed up as complete outcasts, but we left feeling a part of. You know, there were hundreds of people that were waiting to cast their ballots that day for their candidate of choice. We had no money, we had no resources, we had no name ID, all the modern day technology that some of these candidates were using. We had none of that. But what we did have was our stories. And so we fanned out in groups of 3 or 4, and we worked that line. I think it was about 700 people. And we couldn't get a full sentence out. You know, I could say something, hi, my name is Ryan Hampton. You know, I'm your neighbor, live a few blocks from here. I'm in recovery. Just lost one of my best friends, Nick, to a opioid overdose about 5 months ago. Couldn't get any further than that without the person putting their hand on my shoulder and sharing with me how they had lost a loved one to an overdose, how they had grown up in an alcoholic household, how they had a brother or a sister who was in treatment. And it felt as if our community had essentially been waiting for us, our small recovery community, many of who were made up of people who had just gotten out of jail or prison, were formerly incarcerated, were formerly unhoused, most of them unemployed. Like, they were changing the hearts and minds of these people who were seen as like the thought leaders and, you know, quote unquote, the kings of our local community. And it was our community, our recovery community, that was getting them to come out of their shell. So I want to make something absolutely clear. You know, it's through my personal recovery, which I do work a personal recovery program, that I have found personal resiliency, and I have found a sense of community and belonging like I've never had before. But it's through organizing. It's in organizing this recovery community that I've found a passion for change, and I've seen what is possible. You know, many of those community members from that day in Pasadena, California, they went on to be some of our strongest allies. They helped us champion life-saving legislation, such as mental health parity in our state. They helped us pass the first ever sober home standards bill ever to be published by the federal government back in 2017. But we need to remember that today, even as I speak here, there's 40 million people. There are 40 million people just like my friend Nick, who are being told they're unwelcome. They're being told they're unwelcome because they struggle with a substance use disorder. The vast majority of them are being told they're unwelcome to treatment. As we saw in those earlier numbers on the treatment gap, they're being told they're unwelcome to housing. They're unwelcome to the critical long-term supports that could prevent and would prevent another overdose death. Our community, the recovery community, has the power to change that inside and outside the system. So my call to action to you is that we need your help. We need your voice. We need your passion. We need you to help us convince those who make decisions about us to not make those decisions without us. So I'm going to pause there. Thank you. So I'm going to pause there and say that's a version that I probably went about 14 minutes. That's public narrative, right? And it's very different from the story that you'll hear me tell when I'm in my own personal, 12-step meeting or recovery support meeting, such like that. You can, if you hear through the story, people want to know, well, why does Ryan Hampton care so much about this, right? Where does he get all this hope from that he talks about? Well, I get it from my mom. My mother was my agency of hope. Why did I decide that community organizing and civic participation was the way to go, right? From my grandmother, who from a very young age was taking me and teaching me how this worked. And then what moved my feet into action, right? To make this cause my purpose and my passion, right? It was the story of my friend, Nick. So I'm gonna share one more quick story with you about the power of our public narrative and lived experience, but really why we need to advocate for this strong constituency of people who are impacted by addiction and recovery. In 2017, shortly after Nick died, I was, still very infant baby in my recovery, infant baby and the recovery movement, still trying to get my footing. And I was working with a young man named Tyler. Tyler was a little bit younger than Nick. He was 22 years old. I work a recovery program where I had, sponsees and sponsor and things like that. And Tyler actually happened to be my first sponsee. And we had gone to the same treatment program in Pasadena, and he had gotten out and asked me to work with him in the first couple months of his recovery. And so we were doing that. We were meeting daily and kind of had built this bond and trust. And Tyler was living in a recovery house in Pasadena, not the house I was living at, but really one of these nicer homes, right? His family had been paying, I think, upwards of $1,300 or $1,400 a month, so he could stay at this house. Now, this house had been around in the Southern California community for about 15 years, and it was marketed as this quote unquote premier location, for people who were in early recovery or seeking recovery, particularly from opioids, right? Because back in 2017, we were really starting to see just like the havoc that opioid overdoses were wrecking on our communities. So Tyler had been living there for a few months, and we had made a plan on a Wednesday to get up the next morning on Thursday to do some work together, and had gone to a diner that afternoon. And that night he called me and he said, "Change of plans, Ryan. I'm using again. Happened this morning, didn't want to tell you. I went out after our meeting, got high again. But I don't want this to go any further. I want to go get help. Ready? I don't need convincing. Pick me up tomorrow, take me to treatment." I said, "Great. That's what we'll do, right? I'll pick you up, be there tomorrow, 8 a.m., and we'll go to treatment." There was a public treatment center about 10 miles north of this house, which is somewhere where I had gotten sober. And I was gonna pick Tyler up and take him there the next day. So Tyler had come home, I think about 11 p.m. that night, highly intoxicated from use of IV heroin and other prescription drugs, including benzos and the like, and called me again, really intoxicated. And we had a conversation, and I was like, "Are you okay, man?" He's like, are you gonna be able to make it through the night? Like, do we want to go tonight? He's like, "No, I can't go tonight. I got to go tomorrow." I said, "Okay, well, what are they doing with you at the house?" Because we had just gone through this traumatic experience of losing Nick and then, booting Nick out of the house and him dying on a sidewalk a couple blocks away. So yeah, don't worry about it, Ryan. Like, I'm going to be fine. They're letting me stay here at the house. Like, it's not going to be a repeat of what happened. I'll see you in the morning. I said, "Great." So I went to bed that night, and I woke up the next morning only to go through my morning routine, which I'm a former smoker, included a cigarette and some coffee, and logged into Facebook, only to learn that Tyler died early that morning. And I would not be picking him up to take him to treatment. And his loss impacted me on a much different level than I had ever gone through before, even though I had lost a lot of friends at that point. And so I took a beat. I took a breather for a couple hours that morning, but I wanted to know what happened to him. So I got an Uber because I didn't have a car at the time, and took the $10 Uber ride over to that sober living where he was, and went to go talk to the owner of the house and the manager of the house, and said, what happened to Tyler? And got the story. So Tyler had come home that night, was incredibly intoxicated. They asked him to sleep in the living room so that they could periodically monitor him. The actual instructions he got was to sleep it off. And when the house manager woke up at 6 a.m. to come and get him ready so that I could pick him up a couple hours later, he was still alive, but he was going through an overdose. I'm sure many of you have been present on the scene of an overdose, but there's something called this death gargle that he was experiencing, and he was blue. And they didn't have any naloxone, they didn't have any Narcan. They called 911. By the time the EMT showed up, he was DOA, and he died. So of course, my first question as someone who was getting into this advocacy space at the time was, where was the naloxone? Where was the Narcan? Like, how could you be running a sober living in 2017, marketed to people who are in early recovery from opioids, knowing that they're at high risk, and charging his family upwards of $1,400, $1,500 a month, and not having this life-saving measure available? I was a little heated. The answer I got made me even more heated. The owner of that house put her hand on my shoulder and said, "Ryan, you don't need to take your frustration out at me. You should really be sad because Tyler just didn't want to get sober enough." And I thought, well, I won't tell you what I thought because it wasn't really nice, but there was a former version of me that probably would have done something a lot more disruptive than what I did at that moment. And what I did at that moment was I walked away, picked up the phone, called a friend of mine in Missouri who happened to be a harm reductionist. And I said, "Chad, how quickly can you get out here to Pasadena, California, and how much Narcan can you bring?" I said, "I will be there tomorrow as long as you have a couch for me, and I will bring 500 units with me on the plane." And he came out, he was there the next morning, and we had this grand plan that if we couldn't save Tyler, and because of the grief that was going on with Tyler, that the least we could do was get this Narcan and this naloxone to all the houses that were within a 3-mile radius, and there were many. So we packed up, the Uber once again, went house to house, free Narcan. Chad happened to be an excellent overdose response trainer, showed up and said, "Hey, Mr. and Mrs. House Owner, I'm Ryan, this is Chad. You probably heard about Tyler. A few other people that we have in common that we lost to overdose. Love to leave you with some Narcan. Where can we put it? And when can we train your residents on how to use it and how to respond to an overdose?" We went to 9 sober livings and 1 outpatient treatment center over the course of 3 days. Guess how many of them allowed us to talk to their clients, patients, residents, and leave Narcan so that it was openly accessible to them? You were right. Somebody said one. The other 9 said that they were afraid that this would be encouraging use, that it would be seen as a crutch, that they might be giving off the wrong message to their clients. Well, once again, this maddened me, but we didn't have much power as a community at the time, right? Like, the power brokers at that time, they were those providers, they were those sober livings. There were no regulations that were in place. There was no law that said they needed to carry naloxone. There wasn't even a recommendation by the federal government that naloxone be carried in sober livings at the time. So Chad, myself, and another friend, last stop after going to those 10 centers, decided we were going to do a little sit-in at our member of Congress's office, but in a very forward-thinking, progressive, positive way. We went to her office, Congresswoman Judy Chu, 27th District, sat in her reception area for 3 hours. She finally was able to see us. She was only supposed to meet with us for 10 minutes. She ended up spending 2.5 hours with us. And I was fascinated at the level of just information that she had not received on what sober livings were, how many there were that were in her backyard, what they catered to, what their purpose was, what their value was in helping to get people to sustain and enter and sustain long-term recovery. And this was by no fault of her own. This just happened to be back in 2017. No one was really like showing up to her doorstep to provide this information to her. They were just kind of existing in the community. And Congresswoman Chu made a promise to us that day. She said, look, I'm learning all this for the first time. I've heard of these sober livings, but I'm learning all this from the first time, really on a meaningful personal level from you gentlemen who are here in my office. And I'll make a commitment to you. If you work with me, I'll work with you, and we can write a bill. And the bill ended up being House Resolution 4684, also known as Tyler's Law. But it was also the official title of it was the Ensuring Quality Sober Living Act, Safe and Quality Sober Living Act. In this piece of legislation, pretty much it enshrined and codified rules and regulations on how to maintain a safe, stable, quality, sober living that have been around for some time, developed by the National Alliance of Recovery Residences. This bill ended up getting, after about 6 months of work, no national organization attached to it. I'm a huge fan of nonprofits. I run too, and boy, they are on the front lines of the overdose crisis. But I'll tell you, in 2017, we didn't have one nonprofit that was willing to work with us on this bill. It was just a few people in the recovery community who GoFunded me some money so that they could go travel to Washington, D.C. and testify before some House hearings. That bill made its way through the Energy and Commerce Committee unanimously, House of Representatives, Senate. It had one vote against it, and was signed into law by actually President Trump in 2018 as a part of the Support Act. And for the first time, the federal government published these standards, which included naloxone should be on site, management should be trained, it should be easily accessible to residents, and the federal government opened up several $1 million to provide technical assistance to states. Now, I tell you this story because sometimes we think of recovery advocacy really as the big A, right? They're like this big A advocacy where you've got these big kind of American Cancer Society type organizations that are involved in addiction, recovery, and overdose. And they do phenomenal work, right? They change policy, they open hearts and minds, they have resources that many of us on the local community level don't. But it doesn't require that type of infrastructure to make robust change that had not been made for decades prior, that just 2 or 3 people can make happen. And that's why, going back to the beginning of my slide, when we talk about resources, sometimes this crisis feels so overwhelming. We say, well, we just don't have the resources to make the change that we need. Sometimes your feet, your voice, your advocacy on an individual level, your story can be a more powerful resource than having a $10 million organization, right? If you're willing to put the work into it and open the hearts and minds of your legislators and your policymakers. So one last quick story, and then I'm gonna go into the what's next here. What happened in 2017? This week last year, I was in Minneapolis, Minnesota, visiting a recovery community organization, working with them on some policy that they were working through to support recovery support services through some of the opioid litigation dollars. And I had to get a haircut because I had to get on a plane the next morning and go off to another RCO that I was working with. And it was like 8 p.m. at night, found a Floyd's barber in uptown Minneapolis, got there right before they closed. There was nobody in the barber shop. There were 3 barbers inside. Sat down, barber starts cutting my hair and trying to make small talk with me. And I don't know about you, but like I hate small talk when I'm in a barber's chair. I just like to get my hair cut. But there was this kid, this 16 or 17-year-old kid who came storming through the doors about 3 minutes after I sat down to get my hair cut. And he was so lit up. I mean, he was just glowing. He couldn't have been older than 16 or 17 years old. And so the barber next to me had, motioned this kid to come over and sit down in the barber chair. And he starts cutting his hair and talking to him. he says, "Man, you look like you're so lit up like a Christmas tree. What is going on?" And he goes, "I'm so excited. My girlfriend and I, we're going to Las Vegas tomorrow." Well, I immediately started eavesdropping because I'm from Las Vegas. No longer was I concerned about what the barber was talking to me about. I want to know what this kid was talking about. And barber goes, "Well, what's going on in Las Vegas?" He goes, "I'm going to my first EDC festival." For those who don't know, it's this big electronica, electric daisy carnival festival they have in the desert once a year. Lots of drug use, lots of psychedelics, things like that. And barber goes, "Oh, that's great. Are you going to test your drugs, and do you have naloxone?" Kid looks up and he's like, I guess so. And the barber says, "1 second," without missing a beat, goes to his little barber shop drawer, opens it up, pulls out a kit, hands it to him, says, "Put this in your pocket, instructions inside, just in case." Goes right back to cutting his hair. I mean, I get chills when I tell that story still, because that is a sea change from where we were in 2017. It was like he was asking this kid what he had for breakfast. There was no shame, there was no judgment, there was no questioning, right? It was, be safe, here's what to do, know your options, and let's get on with cutting the hair. If we only had more interactions like that, I think we would be way further along in curbing overdose numbers. And this is why I do believe that, non-judgmental harm reduction conversations really at that level are super important. But it also shows that sometimes it's hard for us to see that our work is working, right? It's hard for us to see that these things we do in our local community, and whether it's on the one-to-one level or on the organization level, are working, because the numbers, the overdose numbers, can also seem very overwhelming at times. But then you have moments like that where the work is working because you have that anecdotal experience. So I'm going to move pretty quickly for these last few minutes and just tell you about a few ways that you all can get involved. So there is this initiative called Mobilize Recovery. It's a national nonprofit that we run. Our goal is to expand policy for people in recovery, to create connections to supportive services that are vital and life-saving, and to engage affected individuals in meaningful conversations like you're having today with so many public policy leaders. We convene many times a year. Our next major convenings in Washington, D.C., September 17th to the 19th. It is free. It does require an application process, but I encourage you to check out more at mobilizerecovery.org. If you're interested in that craft of public narrative, if you're interested in learning more about the tools and the tactics available to the recovery community to really address this through a different lens around organizing, I encourage you to please check out Mobilize Recovery. The next is the Recovery Advocacy Project. This is an output of Mobilize Recovery. It's another nonprofit organization. We are an all-volunteer, peer-led organization. Since 2019, our main principle, guiding principle, is that those closest to the problem also are closest to the solution. So we spend a lot of time listening to our community before coming up with agendas and policy items that we work with our legislators on. Since 2019, we've had close to 2,000 organizing meetings across the United States, 141 recovery community listening sessions, nearly 100 town hall events, 22,000 unique action takers, and 165 community organizing trainings. We're organized into state teams. There's actually a robust Washington state team. So if you're interested in it, you could check it out at recoveryvoices.com or talk to me afterwards. I'd love to get you involved. And then the other thing is we do have a Recovery Organizing Institute. That craft of public narrative, actually, when you take the whole skill class, lasts about 6 to 8 weeks. We had 32 people in recovery go through this organizing initiative since 2021. And we've had many of them come out and talk about what a valuable asset this was to them supporting municipal or city legislation, to defeating or supporting state legislation. We've even had a few people in recovery come out of it and run for office as a result of their experience. And all of these tools are available at recoveryvoices.com. So I want to take the last 7 minutes and just talk about like the landscape of where we are and what's next in 2023 and beyond. As your council member mentioned earlier, you know, the surge in fentanyl has really caused us to reevaluate, right? How services are delivered, what services are delivered, where to put our priorities, because the ground is literally shaking beneath us and shifting beneath us every single day in terms of how we respond to this crisis. 75% of drug overdoses last year involved a synthetic opioid, mainly fentanyl. But this also means that now we need a new strategic focus on how we address substance use disorder. Now, traditionally, federal and state governments have focused on a couple of different buckets, including interdiction, also known as law enforcement as one, prevention as another, and then they would couple treatment and recovery together, which is kind of like this pet peeve of mine, because I do think that those are two separate things. But oftentimes when it came to funding streams, you'd see treatment and recovery kind of bundled together. Now, as you'll look from this HHS overdose prevention strategy, this is new. This is a new prevention strategy. It now focuses on 4 primary areas: primary prevention, harm reduction, which now has its own funding vehicle, treatment as its own leg on the stool, and finally, recovery support services has its own leg on the stool. Recovery support services meaning recovery housing, peer recovery, recovery community organizations, things like recovery cafes. You know, we have to sustain people's recovery journeys. We have known since 2016 some of the most recent data that shows that if we can get someone to 5 years, past 5 years in sustained recovery, they have an 85% chance at maintaining that recovery status for the rest of their life. Yet the system we still have built is a little outdated. It only really, the emphasis of support and funding really goes in that acute crisis phase, right? Like, what do we do with someone the minute that they have their emergency or their crisis? We have, you know, crisis stabilization, overdose response, ER rooms, treatment, things like that. But we have very little funding, very little infrastructure, very little capacity when you put it up against treatment and prevention for those long-term recovery support services that we know will get folks to that 85% mark. So the fiscal year 2024 federal budget just came out a couple weeks ago, and it is remarkable. It includes $22.1 billion in resources for prevention. This is just through HHS. $22.1 billion in resources for prevention, treatment, harm reduction, recovery, and interdiction efforts. Most of that does fall on the interdiction side. But the SAMHSA budget is actually quite promising. So the SAMHSA budget is requesting $5.8 billion in public health funding, which is a $1.3 billion increase from last year, from the 2023 enacted levels. And we're also seeing a new request for $1.6 billion from HRSA, which is about $735 million more than was requested last year. Now, those seem like big numbers, and they are, and they're very welcome. You know, every single dollar in investment into this cause is needed. However, I will tell you that advocates on the ground, just on the public health side, let's take out the interdiction side, like just like it was said earlier today, the demand side of the problem, right? We have been saying, public health experts have been saying, advocates have been saying that we need $10 billion per year federally to spend on substance use disorder services, with a minimum $100 billion commitment over 10 years. So the community-based organizing that I've been talking about, the work of nonprofits, the work of recovery advocates, is more important now than it's ever been. So I want to just, I think I'm right on time. Once again, in closing, just say thank you all for all of your work. Thank you for welcoming me here today. Thank you for letting me be a part of your recovery community. We need you. I need you just as much as you need the other members of the recovery community working for these policies across the United States. You know, we're all on a very common journey. Like it was mentioned earlier, this is bipartisan when it comes to solutions for folks with substance use disorder and making sure that recovery is available for every single person when they ask for it and when they seek it. And I believe that, you know, if we work together, it may not be immediate, but eventually we will get to a place if we lead it, if it is led by the recovery community and people with lived experience. So I hope for those that are interested, please check out Mobilize Recovery. I'll be in the back for a while. I'd be happy to take any questions back there. And again, thank you for having me, and I'm grateful to each and every one of you.